All right. Okay, so the presentation that I'm giving today is on trauma-informed care and bringing a compassionate approach into the field of ABA. So some of the things I'm going to go over are what is trauma, what is trauma-informed care, limitations to trauma-informed care in ABA, incorporating trauma-informed care in ABA, incorporating a compassionate approach, using a compassionate care approach in ABA, some ethical considerations, a family-centered approach, and then a compassionate collaboration tool that can be used to help identify if the skills are being used correctly. There's a study that was done to teach compassionate skills to some master students using behavior skills training. I'll go over that. Some guidelines and toolkits, and then some future directions. I have some learning objectives that I've created for my presentation. The first one is participants will be able to describe what trauma-informed care is. The second one, participants will be able to demonstrate a compassionate care approach to their interactions with clients. And then participants will be able to list steps involved in compassionate care skills. So the first thing when we're dealing with this is, what is trauma? How do we define it? How do we look for it? Among the different disciplines and fields, there's not a universal definition for trauma. It differs depending on the clientele that you're working with. But the American Psychological Association has created their own definition for trauma. The APA says trauma is an emotional response to a terrible event like an accident, rape, or natural disaster. So this helps in a general sense of understanding trauma, but it doesn't focus on like school-aged kids, or it doesn't kind of list some different things that could happen with that population. So when looking at school-aged children, we want to look at some different experiences that they may have had with different traumas. So some things to take into account when working with children is to identify, has there been trauma from abuse or neglect in their homes? Have they been exposed to domestic violence or substance abuse from a primary caregiver? Or if they have experienced divorce. So these situations in some way fall under the definition from the APA, but they're a bit more specific, and they can help us guide therapy and interventions. So the next thing we want to look at is, what is trauma-informed care? So identifying what traumas to look for are easier than identifying the traumas themselves. This is where incorporating trauma-informed care principles helps with building a rapport with clients. The Center for Disease Control and the Substance Abuse Mental Health Services Administration, they collaborated to create 6 principles that guide a trauma-informed approach. So the first principle is safety. I think that's very important, right? So providing a safe environment is important because there's a chance that they do not have a safe environment at home, and it will help to build openness in therapy. The second principle is trustworthiness and transparency. When beginning to establish a relationship with students, it is important to be honest about what information shared in sessions can stay private and what information must be shared with proper authorities when divulged. This prevents any situation of breaking trust later on. The third principle is peer support. Having trusted peers can help with healing after a traumatic event. It can help reduce further trauma from occurring. The fourth principle is collaboration and mutuality. It is important to include the client's opinion in therapy and hear what they have to say about different interventions. The fifth principle, empowerment, voice, and choice, is important because being uplifting and pointing out strengths to your clients can help them overcome challenges in the future. This can also help increase existing coping skills and make them stronger. The sixth principle is cultural, historical, and gender issues. Depending on an individual's culture or gender identification, they could have a history of trauma from discrimination. Accepting them and supporting them can help them become more confident, and incorporating these principles in therapy can help reduce re-traumatization, which should always be the most important goal when working with clients. These principles take time to establish and build. They're not going to be formed overnight or in one session. So you can start to use things initially that you find out in interventions, and then as rapports build and different things are understood and known, then you can help grow these things over time and continue incorporating them as they establish. So now I'm going to go into some limitations to using trauma-informed care in ABA. So the first issue is attempting to identify aspects of trauma that may not be presenting through behaviors. So it requires individuals to communicate past events. And if any of these manifest in a non-behavioral way, it makes it hard to create behavioral interventions. An important aspect of trauma-informed care is considering past events that are affecting current behaviors. In ABA, it is not always taken, ABA has not always taken the time to identify these past experiences when attempting to identify behaviors. Functional behavior assessments and functional assessments might not look back far enough to account for different traumatic events that could be affecting behavior. Another limitation is the lack of behavior analytic research associated with trauma-informed care. With a lack of research, it can be a challenge to find socially significant interventions that incorporate a trauma-informed approach. So when it comes to incorporating a trauma-informed approach into ABA, it helps to pull from the principles that the CDC created. The first step is to acknowledge trauma and the potential impact that it could have on the exhibited behavior and development of an individual. So when establishing care with a client and after initial interviews and assessments, all potential traumas may not have been identified. Creating interventions with the understanding that trauma exists and the more will be learned as time goes on will only help the client going forward. The next step is to ensure safety and trust. As discussed before, this is so important for the child's success and their ability to feel comfortable. The feeling of safety should not be in the sense of just physical safety, but also emotional safety. This can help a child lower their defenses and be more open to building rapport and trust. This will help them in learning new skills, in going forward in interventions. The next step is to promote choice and shared governance. So the lack of choice in previous situations could have led to the feeling of powerlessness or lack of control in therapy. These situations that we want to avoid moving forward to prevent re-traumatization. So giving increased choices can help with a feeling of control and help with the safety and trust. The last step of incorporating a trauma-informed approach in ABA is to create interventions that focus on building adaptive skills. So helping to learn adaptive skills like functional communication can help to ensure that basic needs are met, or the ability to express their emotions and how they're feeling can help others understand what they're going through at the time. Learning social skills can help build support systems that can help reduce stressful situations in the future, or help an individual learn how to cope with stressful situations in the future. Incorporating trauma-informed care into ABA is also just the beginning of providing more effective treatment to individuals who have experienced past traumas. So incorporating compassionate care can also help to increase what is being done with a trauma-informed approach. So when attempting to incorporate a compassionate care approach, it starts with empathy. So empathy is the ability to walk in someone else's shoes. It is the ability to hear what challenges someone is going through and attempting to understand how this makes them feel and what emotions they are experiencing because of it. So when talking about compassion, we need to take empathy a little bit further. The ability to become compassionate requires the feeling of empathy and acting on those feelings to help people who may be struggling and experiencing these hard situations. This means seeing how using the knowledge and principles of ABA that we have to help reduce these stressful situations or hardship for different children or their families and what they're experiencing. So some ways that compassionate care is being used in ABA is with Dr. Greg Hanley and his team and the use of skills-based treatment. So SBT starts with a practical functional assessment. So traditionally, a functional assessment is designed to contrive situations that will lead the child to exhibiting what has been determined as a challenging behavior. So this can be problematic if the behavior that is being exhibited is dangerous in some way. If the behavior is aggressive towards others, or self-injurious, or some form of property destruction, setting up these contrived situations to get them to exhibit this behavior, it's not very compassionate. And it could lead to more traumas going forward, or could just overall be traumatic situation. So the PFA is a good alternative because it requires identifying the precursor behavior that is often seen prior to the determined challenging behavior. So what you're doing is you're setting up a situation where you want to attempt to see if you can turn on the precursor behavior, and then how you would reinforce that to immediately turn off the precursor behavior. And hopefully this leads to never seeing the dangerous challenging behavior at all. So that is beneficial because hopefully you never send the child to that point where they're exhibiting that dangerous behavior and causing like further traumas. So on top of the PFA, Hanley's team has coined the term HRE, which stands for happy, relaxed, and engaged. So when working on skill building situations, it's important that the child is all three of those things. So happy, relaxed, and engaged. This shows you that they're ready to work, they're ready to engage in whatever interventions you have for them. And it also kind of shares that level of trust, that level of, hey, you have some control in this as well. And if you aren't these three things, happy, relaxed, and engaged, then you're not ready to learn these skills yet, or you're not ready in this moment. So one more aspect of SBT is saturating the environment with reinforcement. So this shows the child that when they work hard and what they're doing is not going unnoticed. So after they've finished the task, they can have access to any reinforcement they want. It lets them know that we see what they're doing and we want them to continue working hard because we're all in this together. And we're not just here to tell you what to do. And if you don't like it, we're going to let you escalate without, backing off. So SBT has proven to be very successful in the field of ABA, and it is designed with the idea of trauma-informed care and compassionate care approaches in mind. Some other ways to bring a compassionate approach to ABA is to ensure good communication with clients and stakeholders. So this means that when you're explaining every aspect of an assessment or an intervention, you're using terms that everybody can understand. ABA likes to create a term for everything, and they like to have an insane amount of acronyms. So this just kind of helps ensure that everybody is understanding of what is happening and that they'll be on board with the interventions that we're creating to help their child. Another way to use compassionate care approach is to ensure that the goals and interventions being created are socially significant to the children, and then nothing is being done to cause further harm. So another good way to bring a compassionate care approach is to include a family-centered approach to treatment. I will talk about a family-centered approach a little bit more in a few minutes, but I do want to switch gears really quick to some ethical considerations. So just a couple things in the ethics code for behavior analysts. So the second core principle in the ethics code is to treat others with compassion, dignity, and respect. So this means that as behavior analysts, we are ethically obligated to bring compassion into our treatment. So I'm sure also there's a lot of different codes that would relate to incorporating compassionate approach, but I've just chosen a few that are related to some of the topics that I've discussed. So the first one is code 2.01, providing effective treatment. And that code states, behavior analysts prioritize clients' rights and needs in service delivery. They provide services that are conceptually consistent with behavioral principles based on scientific evidence and designed to maximize desired outcomes for and protect all clients, stakeholders, supervisees, trainees, and research participants from harm. Behavior analysts implement non-behavioral services with clients only if they have the required education, formal training, and professional credentials to deliver such services. So this code kind of relates to what I was just talking about providing socially significant services to ensure benefiting clients and to reduce causing further harm. The next code I wanted to bring up was code 2.08, communicating about services. And this code says, behavior analysts use understandable language in and ensure comprehension of all communications with clients, stakeholders, supervisees, trainees, and research participants. Before providing services, they clearly describe the scope of services and specify the conditions under which services will end. They explain all assessment and behavior change intervention procedures before implementing them and explain assessment and intervention results when they are available. They provide an accurate and current set of their credentials and a description of their area of competence upon request. So with the other thing I was just talking about with communicating with stakeholders, communicating with your clients, letting them know exactly what it is you're doing and why you're doing it. It helps them feel that sense of like trust. It feels like they're involved in what you're doing and you're not just there telling them what to do without explaining why. So, all right, to go back really quick to a family-centered approach. So these are just some like ideas that can help with connecting more with the families and helping to keep everybody involved and let them know that what you're doing is to truly help, and you're not just, you're just not just there to like punch a clock, right? You're actually there to help their child. So the first part of family-centered approach is family is the constant. So the family is there every day. So before the client comes to services, after they go home, it's the family that's there. The family doesn't change. Different service providers may change, but the family stays the same. So they are of like the utmost importance. The next one, collaboration with families, is critical. So this is where if they have ideas for what they want, you hear their ideas and you relay them back to them like, yeah, that's great. Like, let's work on that. If it'll help you like feel better and help them in the home life or help them in the future, like let's incorporate that. Disclosing all information with family. So again, this is explaining exactly what you're doing. If you're doing an assessment, explaining what the assessment entails, why you're doing the assessment, and then when you create the intervention afterwards, like why is that the intervention you chose, and like what's it going to do going forward. So honor diversity of families is the next one. And this is just, we could get into a situation where who we are and the culture we have is different than the people sitting across from us. And it doesn't matter what it is. Like, we respect who they are, we respect what they bring to the table. And we know that depending on different cultures, they may not see things the same way as us, but we need to respect them for who they are. And we need to respectfully like suggest different interventions without telling them that this is what we're doing. The next one is be able to understand each families and how they differ. So this is another situation that, we're all different. Every human being is going to bring something different to the table, and we need to respect that. We need to look at the things that we have in common and use those to build on instead of looking at the differences. Encourage family-to-family communication. So this is one thing, as professionals, we understand a certain aspect of therapy, and we can have empathy and we can bring compassion to the table, but at the end of the day, we don't know the full scope of what's going on if we're not experiencing it all day, every day like they are. So having them build a family-to-family like support system so that they can communicate to each other, it really does help in like making it easier for them so that they know that there's other people that they can rely on in those situations. Be flexible to the needs of families. So some things that I've seen, like parents of kids, they have jobs too, and they can't always take time off work. So we have to ensure that we can try and be as flexible as possible to make our schedules meet their schedules as well. And the last one is see clients as children and caregivers as family. And this is, I mean, this is a no-brainer. I know we use like terms like clients and different things, but when we're working with these kids and definitely see them as human beings, what they are. And we're trying to help them, and we're trying to help them improve, and their families are exactly that. They're their families, and they want the best for their child, and they want the best for the future. And so we just need to see that, and we need to help them get that. Okay. So this is the compassionate collaboration tool. So it is a survey. It has a 3-point Likert scale to kind of determine, if professionals are meeting these different compassionate care skills. So this can be used in kind of like a fidelity type situation where a supervisor may see a session and then they can rate them, and depending on how well they did, kind of determine, do we need to have some more training? Do we need to improve these skills, or are you doing well? So I think this is a really good tool to use to determine those things. All right, so Rower and Weiss, they created a study where they took 4 master students in their ABA programs, and they used a multiple baseline design to attempt to teach compassionate skills using behavior skills training. And so they taught them, and they measured the compassionate care skills on 3 different categories. So the 3 categories were interviewing skills, interest in family, and joining with family. And then they broke those down into some sub skills. So when in the interview skills, and when in an interview, like, are you taking notes of what is kind of being talked about? Are you saying that you're taking notes so that everybody's understood that you're focused, you're as committed to this interview and to the interventions going forward as they are? Nodding when they're talking, just to show them that you're communicating. Back channeling, which is if they're talking, you just kind of saying like, like, okay, like just to let them know that you're involved in the conversation. And then overall positive introductions. So in the interest in family section, they looked at child's abilities and efforts. So are you identifying the abilities that the child already has? Are you making notes of those? Are you stating those to the family to let them know that you're seeing what they're already bringing? Identifying the child's interests. So this is like, if you're doing an interview and you have like toys around, like, are you like looking at what they're kind of playing with? Are you kind of getting ready to do like a preference assessment so you know where to start on their interests or their reinforcers potentially? Parent priorities. Are you listening to what the parents are kind of talking about as what they think is most important? And then reflecting and incorporating the parents' priorities. So taking what the parents said and then repeating it back so that they know that you're hearing what they're saying and you're like, yep, this is important. Like, let's focus on this. And then the last category, joining with family. So just empathetic statements. Of course, when they're coming in and you're doing an interview, they're not all just saying good stuff. They're telling you all the hard things that are happening at home and all the hard things that are happening and things that are causing them to not be able to do things as normally as another family might be able to do. So are you showing that the empathy in that? Another thing is normalizing it. So they may think that they're alone in what is happening, and you can say things like, oh yeah, I've seen another client's family like have that same problem, and we do this and it's helped out a lot. Let them know that they're not alone in that situation, that they can there are things out there to help. And then just overall partnering. which is just showing them that you're there to ultimately help them. You're there to ensure that the future does look brighter and it will be better. Okay, so here are, I have a few guidelines and some toolkits. There is a QR code here that will take you to a page with some links. So the practical guide for implementing a trauma-informed approach, and this is from the Substance Abuse and Mental Health Services Administration. And then there's the Trauma-Informed Care Implementation Resource Kit, and that's from the Agency for Healthcare Research and Quality. The Compassionate Care Toolkit by the Center for Compassion and Altruism Research and Education at Stanford University. So these are just some things that people are doing to help kind of normalize trauma-informed approach and compassionate care approach in different like treatments. Okay, so for future direction, there's some things that need to happen, of course, to keep normalizing these approaches and to continue bringing them into different treatments. So continued research in trauma-informed care is so important. So it's not just important in research for actual interventions, that is important, but also like different teaching strategies. What ways can we improve teaching different professionals how to use these skills and like be successful with them? Some behavior analytics specific things can continue helping the field of ABA. I know I talked about the SBT, which is a good one, but more things can only benefit the field. And then some changes in policies and procedures will just continue to increase the likelihood of this becoming like a normal use thing in teaching and like different programs, and then continuing efforts in normalizing these skills. So the more we talk about this stuff, the more people hear it and the more people want to use it. And I think it'll only be beneficial to the future of ABA. And that is all I have. Does anybody have any questions?
Thanks, Trevor. I feel like a lot of the stuff that you suggested could potentially help with some of the controversies around ABA. Because it feels like when people discuss ABA now, there's a lot about if we are working to make life better for the kids, or if we're working to make ourselves more comfortable in how we interact with kids and just trying to make them fit societal standards versus actually teaching them how to communicate. And obviously there's a lot of nuance and consideration in this, but I'm wondering how you see some of the things you suggested here as helping with that conversation, if that makes sense.
Yeah, thanks. That's a really good point. I didn't want to incorporate too much of like the past into the presentation. I wanted to focus on like a positive future, but one thing you were talking about is, so ABA in the 90s required kids to have like quiet bodies and quiet hands, right? And sit there for 5 minutes at a time, not moving before they can work on like a skill. And it's like, that was traumatic. That was causing those issues, right? So the more, and so what kind of happened is those kids grew up and they said, this was happening to me, especially as they started to be able to communicate more. And ABA is horrible, ABA is traumatic, and then kind of the world got involved. So I think using these skills over the next 10 to 15 years, where we can have the voice of the people saying ABA isn't that anymore. ABA is improving, ABA is moving forward. I think it will help a lot. And then just being able to have the research to show people that, look, we're not doing those things that have caused the traumas in the past. We are working to improve the treatments that we're giving to these kids. I think that will help change that kind of stigma that's ABA has still.
Yeah, I think that makes a lot of sense. And I really appreciated your focus on the person and family centered care, because if they are involved in all of the decisions along the way, then you can kind of create a more preventative approach in terms of not stepping in the problems of the past.
Yeah,
You're doing
exactly.
a lot to build up the agency of the client, of the kid, and allow them to be involved in that decision-making process so that some of these problems are dealt with ahead of time.
Exactly.
Thanks,
I
Trevor. Oh, go for it,
have a
Susan.
question. Thanks. Sorry, I didn't raise my hand except here. Trevor, I'm interested in the, and I'm sorry, I don't remember exactly what it was called, the compassionate use, the survey for fidelity. Will you tell me the title of that again?
Yeah, let me go back to that for you.
Thank you.
So
And
the
then,
compassionate collaboration tool.
okay.
Yeah.
So I always appreciate the interdisciplinary nature of social work and BCBAs and school psychology and all of these, you know, we're all on the same team. So can you tell me your thoughts about how the world of social work and could use this tool, this compassionate collaboration tool? I haven't even had a chance to read over it because I was listening, but tell me, would you tell us a little bit more about this?
So yeah, so each like section of this tool, it focuses on a different aspect of your interactions with the family. So like during like an interview process. So it's ensuring that the things that you're doing is involving the family. You're not just sitting there telling them what your plans are. You're communicating openly, you're using appropriate language that's not like jargon to like confuse them with all the ABA terms or different like professional terms. You're being able to explain it so that they can understand it. And then it's just kind of giving you that rating, like how well are you actually doing in those areas and what are some ways that you can improve. So,
Okay,
and I
thank
think that in the field of social work, it's the same thing. They can do the same thing with explaining what it is they're doing in a way that everybody understands. And it's just, yeah, beneficial overall.
Yes, so it's a self-assessment tool for the professionals. All right.
It can also be like a supervisor can like observe an interview and then rate them on this as well.
Okay. All right. Is it new? I haven't heard of it before now. Is it new or has it been around a while? I'm new to this
I think
field.
it's been around for a bit. I'm trying to remember the study. 2021 is when the study came out.
Okay. That's excellent. Thank you.
Yeah. Diana, did you have something?
Yeah, thanks, Trevor. I think this was an awesome presentation and something that I know you were really targeting for ABA and you know, how it fits into the profession, but really goes across fields. And trauma is not one thing, you know, it can look so different and show up in different places and spaces. So just one thing that I was thinking, you mentioned that, you know, trauma might not be behaviors, but it can be. Like just thinking about how it's showing up in all of our places. And one thing that can be really hard coming into a classroom or with, you know, a client, if there are behavioral challenges, is thinking, okay, where did this start? What other things may be attributing? What setting events or other factors are coming into play? So definitely something to think about. I didn't have any big questions. I just wanted to say like, thank you. And really thinking about like how this is showing up in our practicum and assistantships.
Yeah, thanks, Diana. That's something, so like going into the future and like getting a PhD in school psychology, right, will help me be able to bridge some gaps. But as a behavior analyst, if different traumas are exhibiting as like anxiety or depression, my hands are tied. Like I got to be really careful how I approach that as just in the like scope of a behavior analyst, right? But it's, yeah, once you add that like the psychology side to it as well, like the door is open to do so much more. And I think that is definitely a way to do like the max amount of like positive outcomes.
I just wanted to add, thanks, Trevor. That was really awesome. And I'm not a BCBA, but my sister is, and we've had some of these conversations. And I think what's really cool about trauma-informed care is how, like you were saying, it really does kind of encourage like shared professional development, cross-disciplinary consultation. You know, it's like when you talk about trauma-informed care for us as social workers, we're like, yes, we know this. This is, you know, what we practice. And so I think it's just really cool to hear it coming from an ABA perspective, and the doors that it opens for like consulting across all of our disciplines, how we can all support each other, especially in schools. So I don't have any questions, but I just wanted to add that, say thanks.
Thank you.